on YouTube. We just started the stream on YouTube. And just in case you have someone who has a challenge of joining the Zoom channel, they can as well go to the YouTube channel. The handle is Healthy Living Shows. Healthy Living Shows. You just have to search on that and you see us live on YouTube. Yeah, and you can watch us from there as well. So thank you very much. We are excited that we could bring this to your homes. And by the way, this is coming to you via the studios of Salad Master. Salad Master is a health and nutrition company, and we focus on developing your health. And like they say, health is wealth. Now, the information you're going to be getting from this session today is really powerful. Yesterday, we dealt on understanding the coronavirus. Now, what we're going to learn today is going to be really powerful, talking about prevention and treatment. So in case you have someone who already has been tested for the coronavirus, tested positive to the virus, this is the show you want to invite them to. Yeah, because I know Dr. Dolly is prepared. Now, Dr. Dolly is our in-house Salad Master doctor, and she is prepared to actually take over and handle most of your challenges today. Don't be shy to put in your comments, send in your questions, and we are going to be here to read out all your questions when the show starts fully. So again, I want to say thank you very much. It's a pleasure having you on the call. And please invite your neighbors, invite your friends, invite your colleagues at work if you're still at the office, and say to them that we're going to have a brilliant time today. So thank you very much, everyone. Just to say that the show is proudly sponsored by Salad Master. And Salad Master is your best choice when it comes to health and nutrition. So thank you very much again. I can see pictures, live pictures now from the studio. I promised that we have Dr. Dolly, and of course, our one and only anchor, Mr. Tony Bello. He is looking sharp. They are looking amazing, and we are ready to go. Thank you very much, guys. Good to see you in the studio. You guys are looking amazing tonight.
Hi, Marvel. How are you?
Hello, Marvel.
I'm fantastic. We have lots of people waiting to hear and get information about treatment and prevention tonight. And I know you guys are ready. So I'm going to hand it over to you now to kick off the show. Over to you guys.
Well, what I'll say is good evening, everybody. Good evening, the world. Good evening, Salad Master, our sponsors. I'd like to say, obviously, over to Dr. Dolly. Welcome, everyone. Yeah.
Okay. Hello, everyone. It's very good to be here today. Welcome again to another interesting episode of Your $1 Billion Body.
Very, very, it's going to be very, very interesting, isn't
it? Yes.
Wow.
We came, and it's going to be a Power Facts show.
Wow.
Now, this is the concluding episode of what we had the last time. Understanding COVID-19. Now, in this episode, we're going to do a recap for some of you who were not there the first time. Now, in the last episode, we said COVID-19, it is the causative organism of the disease called coronavirus disease. And we discussed it in details. We talked about the areas it affects in the body, the 3 stereotypes it has, the symptoms it presents with, its ways of being transmitted, the risk factors, and its complications.
Wow.
Now.
Wow, so the first episode, I have a lot of feedback from the first episode. It was amazing. Okay. People were like, wow, the information. They got a lot of information. They were happy with the information. Okay. They were even more excited about what we're going to do today, what you're going to do today, because I'm just here to just listen and learn and see if I can ask any questions that the public may want to ask about.
Exactly. So it's very good like that because we want to carry them along. Now, today, we come to the concluding episode of what we started the last time. And now we're going to dwell on the diagnosis, treatment, prevention, and the psychological effects of COVID-19 on the people. Wow. But before we just jump right in, I want to address some misinformation in social media about COVID-19. Now, since the outbreak of coronavirus, the social media world over has been awash with all sorts of information Most of it have truths, outright lies, and misinformations. So, an example of one is I came across one that says that a mixture of ginger, garlic, and herb teas can prevent or even cure COVID-19. Well, the WHO addressed this as such that although spices have health benefits, there is no evidence that eating garlic, ginger has protected anyone from having COVID-19. It can actually boost your immune system, but it doesn't cure COVID-19. So eating it is very well and good, but we need to know why we do what we do.
So just a quick question.
Okay.
So there's no evidence.
No evidence.
Okay. It's not like it can't do it, but there's no
Yes.
evidence. So when we talk about evidence, we're talking about scientific evidence.
Scientific evidence or data that it can cure COVID-19. But for now, what we know is that it can help boost your immune system, which is still all good. So, but no evidence of cure yet. Now, okay, so we go into diagnosis of COVID-19. What do you do when you develop the symptoms of COVID-19? First thing first, the first thing you ought to do is call a family member. Then again, you call your state helpline number first. And when you do that, the call will automatically activate the State Ministry of Health and the Nigerian Center for Disease Control to arrange for you to be transported to a testing center. Your samples will be collected, tested, and they will communicate your results to you. Then trace and quarantine every contact to avoid increased community spread. Isolate and treat you, the patient, and then retest and discharge you after a negative result. Note, it is not every case of catarrh, fever, or cough that will require COVID-19 testing unless there is a history of travel or possible direct or indirect contact with a confirmed COVID-19 case. Now, let's go into prevention. How do we prevent? How do we protect ourselves from this virus? COVID-19 pandemic will eventually recede, but there can be no going back to business as usual. If you are learning anything from coronavirus disease, it must be that investing in health now will save lives later. History will judge all of us, not only on whether we were able to go through this pandemic, but on the lessons we learned, actions we took during the pandemic, and even when it is gone. Prevention can be looked at from these angles. I chose like 5 different angles to look at prevention for it to be holistic and really effective. First one is government role in prevention of COVID-19, closely followed by the Nigerian Center for Disease Control, its role in prevention of COVID-19. The third is societal role in its prevention. The fourth being the family role. And the last but not the least being the individual role, meaning how you personally can protect yourself against this virus. Now, let's look closely at the role of governments in prevention of COVID-19. First point, governments should and must establish isolation and treatment centers in every city in the country. Secondly, proper training of health personnel to be able to tackle the influx or surge of the disease when and if it eventually happens. Third, provision of free buses to testing places. Fourth, creation of captivating and interesting campaign for the masses to be really aware of what is going on. Fifth, decontamination of public places. By that, we mean cleaning of buses for ferrying people, marketplaces, everywhere, contaminating, disinfecting every public place where people will gather and get contaminated. The sixth point is provision of what we call personal protective equipment, PPE, for medical personnel in the country. It is very important, including those people who are in rural areas and urban areas. Eight, the government should also pass favorable policies and bills to curb the disease, because it is said that science without political engagement remains in its ivory tower. Now, we've come to the role in prevention of COVID-19 by the Nigerian Center for Disease Control. First thing they should do is ensure swift and adequate training of health workers in preparation to epidemics, so that we are not caught unawares as a country. Secondly, develop a network of public health labs scattered all over the country. Third, set up research centers into this pandemic and the future ones to extract our own African information and data, and then apply the knowledge for Africans, and to put a stop to this copy and paste method of American and Europe's health system. Now, what do we as a society need to do in order to protect ourselves from this pandemic? First thing is non-contact greetings of people. By non-contact greetings, I mean non-contact, no shaking of hands, no hugs, no pegs. I know as Africans, we're a very sociable race, and this might not be easy for us, but this is a time to adapt, curb our social nature a little bit, just for us to be a little bit healthier.
No, give me five.
No, give me five.
But you know, some people do the elbow thing now.
I think
okay?
that will suffice for now.
But what happens if you have an elbow thing and you're skin to skin? I'm just wondering.
Skin to skin.
Yeah.
Well, it doesn't really contaminate. Yes,
so,
it doesn't really matter.
So you can't. So why is the hand important? And if you touch your elbows and your elbows are.
Yes, because you know why? The places that the coronavirus can use to enter into your body is the eyes, nose, and mouth. The elbow doesn't really have that much of contact with it, unlike the hands that you can use to rub, use to clean your mouth more often. So that's
good. That's interesting.
Yes. Now, the second point is, when exposed to COVID-19, you know that the person you are talking to is a confirmed COVID-19 patient. You should be self-quarantined. The third point is, medical personnel should wear appropriate personal protective equipment in order not to transfer it, because hospitals can serve as hotspots for these germs, easy transfer from one patient to another, or from one patient to a patient relative. So, but if you're well gated in your personal protective equipment, you will help to curb this virus. The fourth one is, people should listen and heed to appropriate and correct messages from trusted bodies and verified platforms like WHO platform, Center for Disease Control platforms, Nigerian Center for Disease Control platform, and this program, Your $1 Billion Buddy. We give out information that is proven and tested. The fifth one is, COVID-19 is real. The society we live in don't seem to really take that into consideration. It's not a hoax, people. Protect yourself. Now, another point is, do not flout guidelines of NCDC. Obey them for your own good. It is for your own good to protect your health in order not to come down with COVID-19. Now, if you have any symptom, like the past episode, we dealt systematically on symptoms of COVID-19. If you have any of the symptoms, please inform your doctor. It is now your doctor that will say, oh, this is not COVID-19. I'll just treat it. Maybe you have malaria or some other thing. Or maybe you have COVID-19 and it will help in calling your health helpline. Now,
so is it the doctor? The doctor, you contact your doctor?
Yes.
Okay. So
if you have something like a fever, cold, catarrh, it can just be common flu. So you might not be in a position to know which one it actually is. It's the doctor that now says, oh, I think I'm suspecting a case of coronavirus disease. We need to do something about it. Or you're just being over alarmed. This is just malaria.
So, I mean, doctors there are not many doctors that you can contact. So are you saying we should contact the doctor? Maybe somebody doesn't have a personal doctor?
Okay.
What would happen in that situation?
Okay. For someone who doesn't have a personal doctor, this program is the very program for you. You can call in, like now that we are online, or you can write your questions, concerns, and suggestions for us. We will now get back to your question and pick it up. You can simply write for us on YouTube or any other platform, Facebook and all of that. I am having headache, I'm having sneezing, I'm having body aches, I'm having this. What do you think this is? Or what do you think I should do? Now we will take it up from there and tell you what to do and direct you to the right place to deal with whatever symptom you're presenting with. Now, I want to look at the family role in prevention of COVID-19. Now, most people will now come into the family house and think, oh, this is my safe haven. I am safe here. I can now do as I please. No. The new normal now is for families to take precaution, be proactive about it. First point, clean the toilet and bathroom after each person's use. Secondly, at home, encourage frequent hand washing by others. Disinfect frequently touched surfaces like light switches, TV remotes, elevator buttons, general phones, door handles, step banisters, keypads. There's so many things that people's hands run through at home frequently. You need to disinfect it frequently, especially the mothers. Keep a hand sanitizer around and a dry paper napkin. Go through it as many times as you remember in a day. You are going a long way in keeping your family very healthy and safe. Another one is maintaining cough etiquette. There's something called cough etiquette. You don't just cough anyhow. No, even if you were doing that, this is time to stop. When you maintain cough etiquette, you will teach it to others also. As we go down, I will explain in detail what I mean exactly by cough etiquette. Another point to the family now is do not share cutleries. It is not allowed now. Drinking cups, towels, and beddings, as much as possible. I know it is not really practicable, but as much as possible, just try and don't share these personal things so that when someone comes down with a fever, you don't give it to the whole family. The next point is keep shared spaces well ventilated and minimize time shared in enclosed spaces like your kitchen, your bathroom. Keep it well ventilated. If there's anything in the air, if there's cross ventilation, it quickly blows it out. But when it's an enclosed space with no cross ventilation and you people cluster in the same place at the same time, that is a very, very vulnerable space that anything can happen. Micro droplets will be fast dropped from conversation, sneezing, coughing, and yawning, making everybody in the room susceptible to COVID-19. We don't want that. That is why this message is coming to you right now. Protect your space. The next point is when taking care of a sick family member, that you think is presenting with coronavirus symptoms, please wear a mask. Call your family doctor, who will then help you in calling emergency operatives. Now, we come to the very sector of prevention. Prevention that is personal, individual prevention.
I have a question,
Okay.
which is one of the questions also from the public. You know, there's these hand sanitizers,
Yes.
and you go to all these shops and they give you hand sanitizers, but some of them feel like water.
Yes.
I mean, some of them, it's like, is this a hand sanitizer or isn't it? Must it feel like water? Sometimes it smells like alcohol, sometimes it smells like water. What's going on?
Yes. Yes, I noticed it myself.
Yeah.
The other day, I was at a shopping mall and hand sanitizer was given to me. It felt like water too, very diluted. On closer inspection, I found out that it was over diluted with alcohol. Maybe the mall was trying to be preemptive and prevent losses through there. So they're trying to increase the quantity of it by adding more alcohol to it. So if you perceive alcohol in it and it's like water, I mean, it's all good, because what we want is alcohol-based sanitizer. If you don't have your own personal sanitizer, using that one is better than nothing. Yes. So, individual role in COVID-19 prevention. What do I have to do? Not what do mommy need to do for me, daddy need to do for me, doctors need to do for me, Nigerian government need to do for me. What do you do to protect yourself about COVID-19? And that is what matters, because all these ones that we've mentioned, government, NCDC, society, family, if it fails, you still can do a whole lot to get yourself protected. First, on the individual level, only a strong and resilient immune system is the best defense against these outbreaks and others that is to come, as well as this COVID-19. Because from what we are observing, COVID-19 might just stick around for even 3 years or more. Whatever the case is, if your prevention game stops, you have nothing to fear. So, a healthy and nutritious diet is paramount to boosting up your immune system. Now, I want you to consciously decide to feed your body well in this era. If you were joking with your food, your diet, this is no time for jokes anymore. WHO recommends having fruits and vegetables 5 times in a day. So, this is time to up your salad game, because in salad these days, you can actually mix both the fruits and vegetables in your salad. And from what I have seen so far by Salad Masters, this machine right here helps you make salad that 500 persons can eat just by standing up and wanding the hand rapidly like that, and the salad keeps churning up for you to consume for your immune system boost. Now, you will also up your smoothie games. Nuts and seeds are a very important part of the nutrition that you shouldn't neglect at this time. All of them have its own nutritional value that it adds to the body, and you need every nutrition you can get right now to keep your body safe. And in the same vein, it is very good to invest in excellent cookwares to get the best out of your food, because you can get all these fresh fruits that you're looking at here, saying, okay, fine, I'm going to consume this and all. But the processor you're using to process it to get to the end point where you will consume it will finally succeed in disintegrating and damaging the vitamins for you. So when you choose your cookwares, and how you make your food and prepare it is also important in absorbing all the nutrition you can get from your food. This is.
I like the because obviously the program is sponsored by Salad Master, and the reason why is because Salad Master is a worldwide company, and what they want to do is try and see how they can re-educate people in terms of the value of the food.
Yes.
You know, your food is very powerful.
Yes.
Yeah, it's even more powerful when it has nutrition.
That's it.
And just like you said yesterday, Dr. Dolly, you mentioned the fact that the only fight we have when we're preventing is our immune system.
That's right.
Yeah? And
That's right.
I think with the increase of vegetables and fruits, that makes a difference.
A whole lot of difference.
Because, you know, what I find is a lot of people, when they're talking about coronavirus, they're talking about the prevention. When they're talking about prevention, they're talking about their outsides, the gloves, the masks, you know, they've got these face things.
Yes.
Which is looks interesting. Looks like you know, I think I might get one myself. It looks like you're going to the moon.
Oh my God.
You know, I'm very worried because, you know, nowadays I'm like, am I on Earth?
Yes, we are.
Am I in the
moon? Sky.
Because when you look at masks associated to a very dangerous place, which obviously coronavirus is very dangerous.
Yes.
But the thing about it is we focus a lot on the hand sanitizers, the masks, the gloves on the outside.
Yes.
But we don't really focus on the inside. And I think I'm glad you're bringing this up because this is why it's important to build our immune system to fight from the inside.
Yes. Yes, that's a very valid point you made. Now, when you are preventing coronavirus, nutrition should be the primary prevention for every individual. Hand sanitizers, gloves, and all the rest are secondary because it is on the outside. Actually, if your body's immune system is low, you can have on at the same time about 15 surgical masks. And once someone who is confirmed to have coronavirus sneezes or coughs, the droplets, even one of them, if it penetrates those masks, it's going to bring you down. Because the foot soldiers in your body, they are down. So what we encourage is, first of all, get your food game right. Get your nutritional game right. Get it all up and running in this time so that if eventually the hand sanitizers, the mask, and everything fails, your body will stand in for you. So we're moving on from there. So the primary prevention is nutrition. Secondary prevention, we now have physical distancing of 2 meters or 6 feet apart from each other. It is very, very pertinent that we can adhere to this. But then people will be asking 2 meters, 6 feet. What is that? What actually is it? Well, 2 meters is simply, you know, the common charger a phone uses, stretch it out. That length is 2 feet, 6 meters. Is 2 meters or 6 feet apart. From the end of a charger, from the beginning to the end of it, if you measure it, it's approximately 2 meters. Now, the second is use of mask. You can use a variety of masks. You can start with cloth mask, it works. Surgical mask, the one that we use commonly during surgeries, it protects the immune system, as well. You can use what we call N95 mask, which is not readily available. There's another one too we call FFP3 mask. It can be used. And then you can glove your hands. Now, let me make something clear. When you constantly wash your hands with soap and water, you don't need hand sanitizers. In the case that you don't have access to running water and soap all the time, you now use alcohol-based sanitizers. And when you don't have that and you're frequently touching surfaces, please glove your hands. The essence is to protect your hands. Protect it from touching your eyes. And then if you are putting on gloves and say, okay, I'm protected, you'll be touching your eyes, breaking pimple on your face, your mouth. No, when you do that, you are coming against the rule of protecting yourself. When you protect your hands with a glove, or you've just sanitized or just finished washing your hands, you still can touch a contaminated surface. So what you do in this part, resist the urge to touch your face. eyes, nose, and mouth in particular, as frequently as you can. Another point in individual prevention of COVID-19 is avoiding crowded places. You can actually avoid crowded places, crowded malls, crowded shops, crowded anywhere, even if it's open air and people are in clusters. You can just take a few steps back. Make sure that you give them maybe like 6 feet or something, 2 meters away from them. That will go a long way, because you never know in the group who is COVID-19 positive. Another thing is, if ever you show symptoms, you have fever, which started in low grade and gradually it's increasing, you have cough, which initially was dry and progressively gets worse, if you have headaches, body pains, and any other symptom that you're not really sure about, and you have family and little ones and pregnant women in the family who you shouldn't expose, the advice is self-quarantine yourself in the room. If anybody wants to bring you anything, the person should be masked and gloved as well. Now, another thing is, every information about COVID-19 you are going to get, be sure it is a credible information, because these days everybody seems to have an opinion on COVID-19. So whatever you take in, be sure that it doesn't eventually turn around to harm you. Okay. The next point is also, because like we said yesterday, the risk of coming down with COVID-19 happens to excessive alcoholics. It brings down your immune system. So in this episode, we want to let you know that you can actually take alcohol, but drink it responsibly. Limit your alcohol consumption intake. Also, avoid sugary drinks. Invest in smoothies, juices, and water. It will help you in more ways than one. Another one is maintaining the cough etiquette I mentioned earlier. What is cough etiquette? First of all, try and go out with tissues. Notice I didn't say handkerchiefs. No. Why? Because handkerchiefs, you can cough into it now and it's contaminated. You don't want to inhale what you have contaminated or mistakenly drop it on the floor and another person, or maybe a child, picks it up. And if you happen to be positive, the child is infected. So now it is advised you take your tissue paper along with you. When you cough or sneeze, sneeze into it. Cough into the tissue paper and squeeze it. Look for a bin that is closed, not an open bin. No, we don't want it, because it can still be blown away and then still spread in the air. So look for a bin that is closed and put it there. After you put it there, you find a place where there's water and soap and wash your hands. Another one is, if you don't have tissue and you happen to be coughing or sneezing where people are around, what you do is you cough into your elbow. Cough into it. It will help in coughing, because one episode of cough can release about 100,000 micro droplets. When you cough into your elbow, it is believed that it reduces the distance in which the cough will travel. If you were meant to travel for maybe like 3 meters, it will now travel for 1.5 meters, because there's a barricade to you. And then if you cough into your elbow, the micro droplets and the secretions you just excreted will now fall to the ground instead of spreading in the air like aerosol. That's the aim of coughing into your elbow. Now, that's the aim of coughing into your elbow. Another point is getting, like we said, eating right. Try and incorporate vegetables into your food very well. Get your smoothies, everything, because after everything, cough etiquette and all of that, it is what you have into your system that helps fight against coronavirus eventually. Now, avoid touching your eyes, like I mentioned before, nose and mouth, especially with unwashed hands. Wash your eyes, wash your hands before trying to rub on your eyes, pick on pimples on your face, or touch another person's face.
But, but it's very hard not to do those things.
It is.
It's very hard to avoid.
Yes.
So, I mean, what are the things that we can do to avoid it? I mean, usually you naturally go to your eyes,
yes.
go to your nose. I mean, are there things that can give us an alarm?
Yes.
Say, like when it's coming to my mouth.
Okay, fine. Even if you have hand sanitizers at home, putting on gloves can help to tell you that, oh, something is going on. If you absently was talking and you bring your hand to your face, you see a white substance on your hand. Oh, what is it for? Oh yes, I'm not supposed to touch my face. It can help you with doing that. Another thing is getting your family members or friends or people who you hang around informed, so that when you do it, they say, no, you're touching your face, don't go there. It helps to prevent it. That's another way.
Just seeing the gloves, as you're going to your face. Okay, this is not a hand.
Yes, it's not a hand, because normally you don't do gloves. But now there's a reason, and when you see it, oh, this is contaminated, I can't put it in my eyes or nose.
I suppose wearing a mask helps you not touch your mouth. Yeah?
No, because I'm going to come to that.
Okay.
I'm going to come to that. Most people think, oh, I'm wearing a mask, I can do anything.
Yeah.
I can touch any. No, that's not true. You can still contaminate the mask you're wearing.
Oh.
Yes, you can still contaminate it. As we move along, I will demonstrate the right way to put on a mask, especially cloth mask. The right way to put it on, to wear it, and then when to put it, to keep it and know that this cloth mask is soggy or soiled. Because I can see a whole lot of people, because your mask happens to be a cloth mask, you wear it all day. No. That's not.
But if I remember rightly, in Lagos,
Okay.
I think there's a law or something that's just been passed.
Okay.
That you have to wear a mask in public places.
That's right.
And if you have to wear a mask in public places and you're in public places all day, would that not mean you have to wear your mask all day based on that law?
Yes, it can mean that, but it can also mean that you have another spare mask in your pocket.
So you have two masks?
Yes, you have two masks in your pocket. So when you feel that this particular mask you're wearing, because as you talk, the salivary secretions are being impacted on that face mask. So when you feel it soggy, you know that this mask, no, I can't wear it. You put it in your pocket, wash your hands, then get the other one that is fresh and put on.
How long would you advise someone to wear a mask for? What's the longest period you think somebody should wear one mask?
One mask. Well, I should say, for me, I wouldn't want to put a limit to that. You know why? Because when you're wearing a mask and you're not talking, you're working on your computer or anything, there are no secretions to contaminate it. So you can actually wear it as long as possible. But when you're talking or you have a running nose, the mask is already dripping. So for me, as long as your mask is not soggy, you can still wear it. But as long as you feel that you know when it's soggy, it's getting wet and all of that, it's time to discard it and get another one. Or if you are not talking and then you're wearing it for a long time, let's say 5 hours, but then again, it is not advised to wear a mask without removing it consistently for 5 hours. It is detrimental to health. Yes.
So let's say someone's wearing a mask, they don't have coronavirus. Yeah.
Okay.
And so why should it be a problem wearing the mask all day if you don't have coronavirus? Why should it be a problem? I mean, is there something that happens when you wear the mask too long that might, when you come in close contact with somebody that has the virus, that means the mask becomes ineffective? Is that the reason why we need to change it, or is there anything?
No. Wearing the mask first of all, protect you from others. Now, if I happen to be negative of coronavirus and I'm wearing a mask and I move out of my house to meet people, you never know who has coronavirus. So when they speak, if they are unmasked, when they speak, their secretions might fall on your own mask that is not infected. And you will now handle your mask, touch it. This is me. I'm not infected. I can touch my mask. You touch it and invariably happen to touch your eyes. You've infected yourself, but you wear mask and healthy. Yes. So the thing is, coronavirus patients don't have any sign on their forehead. We don't know who they are.
So I think you just opened another question.
Okay.
Which is like, it's not the inside of the mask you should be worried about by wearing it for a long time.
No.
It's the outside of the mask.
It's the outside of the mask.
So therefore, if you come in contact with someone with corona,
yes,
and they whatever, and it comes onto your outside your mask,
yes,
then that's the reason why you need to keep regularly changing it.
Yes.
But then when you change the mask, are you using hand sanitizer?
Yes, I understand where you were coming from. If you are wearing a mask and you are negative, and there's no coronavirus patients around, and you think, oh, it's cool, I'm wearing the mask, I'm protected, so why do I need to change it? Wow. The reason you need to change it is this. When you're talking and the secretions come, they wet the mask. And when the mask is wet, it is easily penetrable. Yes. So that's why it is advised, when it is soggy, you remove your mask, put it in the bag. If you have another, or you are advised to get another, wash your hands, take that one off your pocket, and reuse. With this one, it is fresh, it is new, it is dry. So it is really a barrier. But when it is wet, you might think you're wearing a mask, but it's really open pores for the virus to flow in.
That's what, I get it. But let me ask another question. Okay. When the masks started coming out, there was only certain kind of masks that were available. Mm-hmm. And then suddenly more masks became available.
Yes.
And then suddenly these cloth masks became available. And now everybody has different masks. I've seen somebody with a mask that is actually, when you go into the plane, and you wear this when you're on a sleep. Yes. They have this thing that you put over your eyes.
Yes.
I've seen people with masks that are sleep pads. So what are we? I mean,
that's wrong.
What's the directions or what are the things that you need to check about your mask to see whether it's valid? Because otherwise, if you're wearing a mask and it's not going to do anything, then
why bother with it?
Yeah.
Well, when the mask wearing of masks first came, the first mask that we see people wear were the N95 masks.
Right.
Yes.
Is that medical?
Yes. Medical. It's a medical mask, and it's very protective because the pores are very tiny. It sieves out most of the things it has. It comes in contact with. Now, when the N95 it became highly demanded, and it wasn't available even for the health workers. Now, it is now said people should leave those ones for the health workers. Why? Not because they are the ones that their lives should only be protected. No, it's because they come in contact more with active patients. So they need to be protected. They need to wear those masks in order to sieve out the virus and get themselves protected, in order to be fit to attend to more patients. And then to those of us who might not really come in contact with those patients who are not in the line of fire, you are now advised you can wear cloth masks because there's reduced chances of running into an active case. Right. So you can just have it on and protect yourself against the unknown.
So in theory, what you're saying
is
that we're less protected than the medical staff.
That's obvious. Yeah. It's obvious. Okay. N95 mask is better than the surgical mask. And then the surgical mask, I can't say it's really so much better than the cloth mask, but there's a huge difference. The main difference I find between the surgical mask and the cloth mask is one. Surgical mask is meant for you to wear it for a longer period of time while taking in air. The way it is made, the fabric is thinned out in order to let air pass and flow easier than a cloth mask. And the cloth, depending on the kind of, some people can just go and design their cloth mask and make it thick. If you wear such a thick mask for a long time, you are going to reduce your oxygen level in the blood, and it is not advisable. So what is advisable is, if you can get a surgical mask, please do, but bear in mind that you change it more often than a cloth mask.
Are the surgical masks the ones they put on the operation?
Yes, yes.
Those are the ones.
The one that has.
Are those N25, N95?
No, they're not N95.
Those are surgical masks.
Those are just for surgery, surgical masks.
Okay. But
yes.
Aren't they designed just to use once and throw away?
That is the design. So if you have a surgical mask on, you need to have a pack of it. So you change, whenever it's soggy, you change it. Because if you take a very good look at the surgical mask, it has two surfaces, a deep blue surface and a lighter blue surface. The deep blue surface is meant to be outside, and the lighter blue one is meant to be inside. Why? Because it has an absorbent surface. It absorbs the secretions. Yes, it absorbs it, which the cloth mask doesn't do.
Right.
Yes.
Very interesting.
Yes, very interesting. So another thing is avoid close contact with people who are not well, irrespective of the cause of the sickness, because you don't know. So the best thing, and to be on the safe side, is avoid everyone who is sick until proven otherwise by health officials. Now, another thing is, in this period, in this era, you should do everything possible to avoid harmful addictions like excessive alcohol consumption, like I said earlier, then taking crack cocaine. Cocaine, as we know, it lowers the immune system. So if you want your immune system to be up and about, this is not the time to sniff anything at all. Secondly, cigarette smoking. Cigarette smoking already is affecting the respiratory system. And as we said in the previous episode, coronavirus attacks mainly the respiratory system. So if you're already smoking or you're a chronic smoker, just know that if you ever come in contact with coronavirus, you are likely going to have a complicated case. Yes, irrespective of your age, irrespective of your immune system. That's it. Another thing you can do for yourself to protect yourself from coronavirus is exercise. Get up from the couch, move around. WHO recommends that adults should exercise at least 30 minutes of physical activity every day. And children should have at least 1 hour of physical activity every day as well. You can go for a walk. You can jog, you can do yoga, you can go to the gym, not crowded gym, maybe in-house gym, you can go for that one. Go and have a swim, dance, do anything. By all means, move your body, move, because you know why? The circulatory system is always moving. And when you are sedentary and in a place for a long time, it tends to move but sluggishly. But when you move, the blood circulation moves speedily around your body, so that if ever you have coronavirus at the tip of your nose, if the blood is rushing through there, it immediately tackles it even before it comes inside, because that's the way the immune system, it has different barriers, outer barriers. That's the way God made it, so that you keep at each point there's a blockage. So if your immune system, the blood circulation, that is, immune system is none other than white blood cells and other lymphatic organs that I don't want to, that's another topic on its own that I'm not going to go into today, but let's take it like this. Let me break it down. White blood cells are the immune cells in the body moving in the blood. So if you can get them, move them around your body so that they stand guard. Every 5 minutes they've gone round to check. Is there an intruder here? Is there any virus? Is there any bacteria? Is there any protozoa? Keep it moving. So the more you exercise, the better for you. But when you are exercising and you have an underlying disease, obey your body. when you are tired, please rest. But do exercise. It's very, very important for your immune system. Now, the next one is pregnant women. In this very era, pregnant women should be fiercely protected. They should avoid going to the mall, market, crowded places if it's possible. People should volunteer to help pregnant women around them. If they don't have help, if you're a neighbor to a pregnant woman, offer help. Please, madam, you want to go to market today? Can I help you get some vegetables, fruits? Help them, because naturally in pregnancy, your immune system drops. Yes. So if you help a pregnant woman as well, you're helping the unborn baby. So we have to really protect pregnant women, give them mask, and mask also is not good for them because they are breathing for two. If a pregnant woman should lose oxygen for 10 minutes, that's not nice. So we should protect them, keep them indoors as much as possible, feed them right, help them exercise, and help them avoid all the crowded places that women normally love to go. Because every woman I know loves to go to the market and shop for the family. But this time around, she can be excused.
I think it's because they're taking care of the baby. The immune system is taking care of the baby.
Yes, I think it's protecting too now.
Yeah.
So naturally, it drops in pregnancy.
Okay.
Yes. Then another point is people also with underlying diseases. When we mean underlying diseases, we mean some lifestyle diseases like hypertension, diabetes, and all the rest. What you need to do in this case is don't miss your follow-up with your medical doctor, eat well, and any symptom you have that you are not used to seeing before, please alert your doctor. And then again, I'm looking at another group of people here, the obese people. If you know you're fat, you're obese, please, this is the time to try and work it out, because obese people, they have also reduced immune system. So will be a very good time to attempt losing weight, attempt exercise, attempt eating nutritious food with lower calories so that you don't pile up, because in very, very obese people, coronavirus can be very, very bad.
Well, like we said, this program is sponsored by Salad Master.
Yeah.
And that's interesting because in the Salad Master, we actually show people how to reduce fats and oils in their diets.
Whoa.
And also to maximize nutrition, as you've seen many times.
I've seen that.
And that's one of the reasons why you decided to come on to have a program sponsored by Salad Master.
That's spot on.
Yeah? So really, I think it's important that we listen to Dr. Dolly about reducing our weight.
Yes.
I mean, I'm an example of that, where I've reduced my weight through diet, through food.
Yes.
Yeah. And you can reduce your weight, actually, surprisingly, by eating. Some people think reducing their weight is not eating.
By starving.
Exactly. No. I mean, you can reduce your weight by eating, but having the food prepared in the right way, and therefore preserving on the nutritional value. Yeah. Okay. So over to you, Dr. Lewis.
Okay. So that is all we are going to say on individual protection or prevention from COVID-19. If you have any more questions or confusions, you are free to ask your questions right now or write it online and we'll give you a reply much later on. Now, during this COVID-19, it took a toll on our mental health. There is a psychological aspect to this disease that people tend to downplay, but it is even more real than the physical effects and symptoms of COVID-19. Due to the extended lockdown, due to the social distancing, human beings, as we know it, were a very social being. So being on yourself, some people during the lockdown were living alone. That way, they couldn't get in contact with anybody. And over time, yes, you might try to reach out and do stuff, but there's nothing like that personal contact. So most people didn't get it, and it has a way of manifesting itself. So let's look at the psychological effects of COVID-19 on your mental health. I divided it into several categories. The first one I'll have you know is that you can have your behavior can change due to psychological effects of COVID-19, which you are not aware of, but other people might have noticed it. Now, if anyone so far has called your attention to some of these behavioral changes I'm going to list out, please do well to follow the advice that will be given at the end of it all. First, behavioral change. The first behavioral change you will notice in anyone who was psychologically down during the lockdown is overeating or undereating. Previously, you were not a foodie. You were not so much into food, but right now you love food. You binge on food. That is, you're having psychological manifestation of something. There is something, and most people, you might not have it at the time of lockdown, but it is having a way of coming out right now. Observe yourself and notice. If you started overeating or you're not eating enough, that's a sign to something. If you're having frequent angry outbursts, normally you're a calm person, but all of a sudden, if anybody says something, you fly off the handle. If anybody does something, you're on that person. Now, look at yourself and check. Why am I always on the edge? Why am I easily irritated? Why is it that whenever a button is pressed, I fly off the handle? It's time to look at yourself and say, am I having any psychological effects due to the lockdown, due to loneliness, due to distancing from family, friends, and loved ones? Another one is drugs or alcohol abuse. Right now, you don't know how you're feeling lonely, you're feeling locked away from the rest of the world, and you now drive yourself to drinking more than you should or doing drugs. If you do that, that is an indication that there's something wrong, there's an underlying problem that you need to tackle. Another one is social withdrawal. Prior to the lockdown, you were the social butterfly. You were the life and soul of a party. And right now, there's no party. You are now socially withdrawn to the friends that you used to know. That is not a good sign. Now, for other people who were gym buffs, they were always in the gym, exercising, and right now, you don't have the zeal anymore. You don't want to exercise. You don't even want to go out. That's also a manifestation of something. Another one is careless appearance. You don't take care of your appearance anymore. You get out of the house wearing a bathrobe. I've seen it happen so many times. People come outside the house and they are clothed in the bathrobe. They are coming outside the house and you're wearing your hairnet. You're coming outside the house and you're wearing your bathroom slippers. Where are you going with that? But people who used to know you know that you were not like this. You don't dress well again. You just put things together and off you go. No, that's a sign. If you were not that kind of person before now. Again, most importantly, is suicidal thoughts. It flashes in and flashes out of your thoughts. People are having suicidal thoughts now, or things are not going as they should. My business is down. This is happening. I think the only thing is to end it. No, it's not to end it. Everyone or every generation, our generation is not the first generation that has come in contact with a pandemic. It will also be a thing of the past sometimes. So all we need to do right now is to be patient, hang in there. It's going to be well again. Don't let it take a very bad effect, because there's so many suicides right now on social media. I've seen so many, and I don't want anybody who has seen this program, who's watching this program, to ever be a victim. Another aspect of psychological manifestation of COVID-19 can be intellectual. Your behavior is good, you're calm and collected to the outside world, but in you, you know that inside you, your judgment is impaired, which doesn't happen to you, and you are not even old. you're having impaired judgment. That's a sign that you're dealing with something that we don't know about. Another one is inability to concentrate. We're talking and doing stuff, you lose strength. Okay, where were you? What was I saying? What did I say? That shouldn't happen. So when it is happening and happening often, because sometimes it can actually happen to normal human beings, that's when you now say, wow, this, I need to deal with this. Something is going on here. Another one is when you're easily distracted. When you have memory loss, excessive worry. What is going to happen? Hey, how many is dying in this country? How many is dying here? What is the stock market? What is this one? What is this one? From one, the truth of the fact is, there was always something to worry about before the pandemic. And as the pandemic is here, it has given us a lot more to worry about. So the thing is, don't give in to the worry, because if you do, it might give you your mental health a breakdown. Another one is difficulty in making decisions and procrastination. These are intellectual manifestations of the psychological effects of COVID-19.
So memory loss. No.
Yes, memory loss.
Yes, I've been losing my memory for a while.
No.
But no, on a serious note, the procrastination,
Yeah.
is that someone that is wanting to do something and like feels like they need to kind of like, they keep on saying,
Yeah.
like somebody that might be on lockdown.
Okay.
And they've been on lockdown and now they've released us to go out, and
Yeah.
they're still kind of like feeling that they're on lockdown mode.
Yes.
Is that something that is psychological? But I've seen a lot of people now, even though we've moved on to the next stage,
Yeah.
they're still on the stage that we started with.
The lockdown stage.
Yeah, where they're still not quite sure or not quite willing to do a little bit more.
Yes. Now, procrastination, when you're just procrastinating because you're not sure, that cannot be a psychological effect. But this kind of procrastination comes from inner will. You don't even want to do anything. There's no inner drive. The drive is gone to do stuff. So what you're supposed to do, you keep, I'll do it tomorrow. There's no drive. There's no will. The zeal is gone. That is how it starts. Yes, that's how it starts. But when you're procrastinating based on facts and figures, data, or you're surveying the economic situation of the country and say, okay, this is not yet time for me to move. No, that's not the kind of procrastination I mean.
But would we say some of those psychological effects affect like business people? Because I can just imagine like you're a business person, you have a shop and it's been closed, you have employees and it's been closed for 3 months. What kind of, that must have a psychological effect. You have to buy stuff, you have to sell things, and it's all stagnant.
Yes.
Yeah, just like that.
Yes, of course. COVID-19 has psychological effects. That's why we are bringing this up, so that when you start manifesting things like this, you know that this is the effect, the COVID-19 effect on my mental health. That is what is manifesting. And when you know that this is what you're manifesting, then you now find ways to solve the problem. But the problem stems from when you are manifesting these things and you don't even know what it is. Before you now get a hang of it, it has totally done a lot of damage. But if you know that this is what is happening and it's happening because of this situation and I need to do something, that is when it's a healthy approach to the mental health state you'll be put in by a situation that is beyond your control.
And the last one I was going to ask is worries.
Okay.
I think everybody's worried.
Oh, everybody, yes.
Everybody's worried. So that's a psychological effect for everybody.
Yeah.
Because everyone's worried about what's going to happen next. Or what's happening now.
Yes.
Or when the airport's going to open.
Yes.
Or when the international airport's going to, there's so many worries. Or when the banks are going to be normal.
Yeah.
So those kind of worries. I mean, all these psychological, is there anything that you can do about them?
Yes. Yes. Every psychological effect is a mental thing. So since it starts mentally, it can end mentally, just by adapting a different approach to situation and things. When is the airport going to open? If you worry from now till tomorrow, it's not going to change a thing. So why not tell yourself, fine, I'm going to switch off. When they open the airport, it opens. Take it one day at a time. Enjoy today. Fresh air today. The sunlight today. The birds today. You are healthy. Everybody, so many cases of COVID-19, deaths have been recorded all over the world, and you're alive and healthy. It's a very beautiful thing to take your mind off the worry. Knock it off and live life by the moment.
Right.
Yes.
And there's a saying that goes, don't worry about what you can't control.
No need. No need to worry about what you can't control. So it's about the mind game. Switch off the worry button. Yes, you can. Now, another manifestation of this psychological effect, it can come to personal well-being. When you now start doubting yourself, questioning your values, having a loss of purpose and meaning to your life, having loss of direction, feeling lonely, feeling isolated from family and friends. And some people, in order to cope this or solve it in their way, they will now get excessively busy, burying those emotions. No, it's not supposed to be buried, because what happens in this kind of a case, if you bury it, it erupts like a volcano. The day it will erupt, it will crush a whole lot of things. So the thing about it is, this is how I'm feeling. Since after the lockdown, you need to talk to someone you trust, someone who listens. Since this lockdown, I have been feeling very lonely, very isolated. What should I do? Okay, let's continue. This is the personal well-being effects of the psychology. The next one is after you, like I mentioned, please, we should not be ashamed to ask for help. Don't be. Now, when you have all this psychological trauma and you didn't deal with it, what it does, the first sign it gives you is that when you're feeling lonely, when you're feeling lack of drive, the thing it comes in, it manifests physically. It starts behaving like you are down with an element, maybe even mimicking COVID-19 symptoms while you're actually healthy, because you're down mentally. So it is manifesting physically. The first physical manifestation, is you have muscular tension. There's tension in the muscles. Note I said tension, not pain. There's tension in your muscles. That's how you know that this is coming from up. Another one, persistent headache. Whatever you do, you have headache. Difficulty in sleeping. You go to bed by 9 o'clock, you toss, turn till 5 a.m. and then you sleep. 7, you're up. That should be looked into. When your whole body starts trembling, all of a sudden, starts shaking, and there's no reason for that. You looked at yourself, you've taken breakfast, you've done everything, and you are shaking. You better take a second look at yourself. It might be psychological stress manifesting as a physical symptom. Another one is when you're having frequent cold, although that can be excused because we are in the rainy season, but then when it becomes more frequent than usual, that should raise an eyebrow. Another one is rapid loss or gain in weight. Weight loss, weight gain shouldn't be rapid. Anything other than that, that's abnormal. Another one is when you have low energy, low drive. You don't want to walk, you don't want to do anything. Everything you have, you're pushing it forward, you're procrastinating. That can be a physical manifestation of a mental stress. Another one is significant tiredness, stomach upsets. When you have this, you know that, wow, there's something here that meets the eye. Then you dig deep and address the very issue that you had during the lockdown. Another aspect of it is emotional. Look at your emotional state. How is it? Are you anxious, more anxious lately? You feel angry more irritable? By irritable, I mean whatever you do, you're irritated. You hear the bang of door. Why are you banging the door like that? You whisper, I can't hear you. The person shouts, you are shouting too much. That's when you're irritable. Every little thing irritates you. That is when you should check it. This is not normal. Then feeling of depression. Are you depressed? You feeling hopeless, trapped? Are you feeling that life is out of control? Are you feeling self-conscious? You feeling incompetent? Are you, if for those of you who are married, how is the sexual life? Do you have a change in sexual life? Is it lower than what it used to be? All these things are manifestations of an undressed issue that you need to tackle. Now, when this happens, you manifest one or more of the symptoms I just mentioned about the psychological effects of COVID-19. What you need to do, first thing is talk to people you know, talk to people around you, people you trust, you can open up to about your fears, your anxiety, your worries, and the stress. Check on your neighbors too. If you're fine and you have no manifestation, check on your neighbors, check on your friends. They might be suffering from something you don't know. You see them physically, they are okay, they are bouncing, you think everything is okay. Everything might not be as you see it. So dig deeper. Are you okay? How are you? How's business? Ask questions, ask questions. Check in on loved ones, let them know you care. Then another thing is sleep. Prepare for sleep so that you can sleep well. Make it a prepare, make your bed, make the sleeping area very, very conducive, very appetizing. Your bed, make it do if you need, read a book before you go to bed, drink a glass of milk, and make sure you sleep well. If all the symptoms persist and you feel really there's something that needs to be addressed, that it wasn't solved by talking to friends and family, talk to a psychologist, talk to a psychiatrist, talk to your doctor. You can start from there. For those of you who have a priest, you can talk to your priest. And then, like I said before, do not be ashamed to ask for help.
I'm going to say ask for help.
Yeah.
I'm sure some people on this show, and they're looking at you, Dr. Dolly, and saying, well, I can see a source of help here.
Oh, yes.
So is it possible for them to contact you?
Very possible. We're here for them.
So really, they just have to just subscribe, subscribe,
yes,
and then send your comments. And if you'd like to meet Dr. Dolly or have a conversation, then we can do that too.
That's right.
Yeah.
Not only do you subscribe, also put up notifications so that whenever we have a program like this, you're notified, because you never know. We might just be addressing the very problem you're passing through, and you can learn one or two.
So Dr. Dolly, before we finish off, obviously we talked about the immune system.
Okay.
And I know that for me, when this whole COVID-19 started,
okay,
I remember my wife saying to me, take vitamin C.
Okay.
And vitamin C became like priceless.
Yes.
And there's this tablet called vitamin C that has vitamin C. You take it, you put it in water, you take it. I think it's once a day.
Yes.
Yeah. And what is that supposed to do to the body? Just briefly.
Yes. Oh, the vitamin C. It was a very good one because, like we said, the primary protection you can give to yourself in this COVID-19 era is to boost your immune system up. And vitamin C is a known immune booster.
Right.
Yes, that's why people were going for it.
Okay. So a lot of people were saying to me, well, if we say like the food is powerful,
yes,
and why is it that we may be deficient in something like vitamin C, or can we get it from our food?
Yes, we can get it from our food.
Okay.
And the thing is, if you can get vitamin C from your fruits, these are oranges, this is lemon, these are citrus family fruits. Yes, these are citrus families, and they are packed full of vitamin C. This is a citrus fruit full of vitamin C. If you can take this, WHO recommends taking 5 fruits 5 times in a day. If you can have it raw and fresh, you don't need to go for vitamin C. All through the lockdown era and all through those times that people were rushing to buy vitamin C, I was rushing to buy my fruits.
Wow.
You know why? Because the vitamin C that is in a tablet has already been processed. So it can never contain the same amount of vitamin C that this citrus fruit possesses. So the best thing is to go get it raw and fresh.
So when it's fresh, it's probably even more effective, isn't it?
It's not probably, that's the way it is. The fresher it is, the more effective it is.
Wow. And also, you know, we have a lot of vegetables. You know, these kind of things help us too, don't they? In terms of the immune system.
Oh yes,
Yeah.
carrots also helps the immune system. And then the eyes. Carrots sharpens your sight. You know, it contains carotene, so it is good for you. Every fruit here, in as much as it basically contains carotene, that is the carrot, it still contains quantities of vitamin C, but in lower quantity than an orange.
This is a cucumber.
Yes.
Because I think now we are health conscious. We're starting. We have to explain to people like this is a cucumber.
Oh yes.
Because some people might not have seen a cucumber.
Oh my God.
Yeah, and this is, obviously it's a lot of water in there too.
Yeah.
Natural water.
Keep you hydrated, give you the macro and micronutrients you need to be healthy. So the importance of fresh foods cannot be overemphasized.
I mean, the reason why I mentioned this is because, you know, I think a lot of people now are looking at boosting their immune system.
Yes.
And one of the ways is obviously through fresh food.
That's right.
But the key thing is a lot of people say, you know what, I like my food cooked. I like it nice and hot. Okay. And therefore, when we go through the process of cooking, we can lose
nutrition
and minerals. Yeah,
that's right.
And that's one of the reasons why Salad Master sponsored the program.
The cookware is out of this world because you know why? It preserves your nutrition. 93% of all your nutrition is contained in your food after being cooked. Unlike most cookware I've known or come in contact with, which when you use it to cook your food, at least you just get maybe like 50 or even 40% nutrition, which is suboptimal. If you can get 90 or 93%, why not go and have it?
Exactly. You know, one of the things I always say to a lot of people, and I say, look, you know, as we said, the $1 billion body, you know, we say the program is the $1 billion body shape.
Yes.
You know, to be honest with you, my body is worth more than $1 billion.
Oh my God!
Yeah? And I think yours is probably, you say priceless.
That is it.
It's priceless, really. So the $1 billion is just a figure, but really our bodies are priceless. And one of the things, like we always say, is like some people buy cars for 40 million, 50 million. You know, when you buy a car for 40 million, 50 million, what is it that what fuel are you gonna put into your car?
That is it.
Are you going to put Are you going to put fuel that you don't know where it came from? Are
Definitely
you going to
not.
go to an unmarked petrol station? You know, are you going to just pick up
adulterated fuel?
Exactly, kind of what, you know, and so on. But we do that to our bodies.
Oh my God!
Because we buy food and we don't even know how it's actually made or where it came from or how it was washed and so on. And you know, a lot of the problems in Nigeria today is through all these different waters and food that we eat. So I think it's very important for us to now be careful.
Yes.
It's very important for us to now build our immune system.
Build it to be on the top notch. Exactly. This body, your body, is the only vehicle you have to drive you through life.
Wow.
It is the only one. So treat it like it's the only one. Treat it like it is precious. More precious than gold, silver, cars, houses, and every asset, because everything you own right now you can lose it, it can be destroyed, it can be stolen. But if you have your body and it is healthy, you can make it all back. But if your body is being riddled by diseases, all the cars, all the houses, and all the money can get you another body.
True. Okay,
so with this, we come to the end of today's episode. I want to bring to our notice that because we are humans and in human nature, we all love to have positive results, but hate the process. It is time now to step out of your comfort zone and actively pursue a healthy lifestyle. And in this time and era, it is good to be patient with other people's faults. You never know what they are passing through. And then love people a little harder right now. Tolerate more. Be more patient. We all need it right now. This is a rough patch in our lives that I know will definitely get better, but we're still here for now, so we need to exhibit a little bit patience with ourselves and with others. And remember that nothing tastes as sweet as healthy feels. Did you get that? Nothing tastes as sweet as healthy feels.
Wow.
Yes.
Nothing
tastes as sweet as healthy feels.
So that means stay healthy.
Oh my God.
And you will be sweet.
You live a sweet life. When you're healthy, your life is sweet. So I believe my future, your future is beautiful and healthy. Only if you can start right now.
So before we finish up, I think do we have any questions, Marvel? I think.
Okay.
Marvel, do we have any questions?
Wow. Amazing. Fantastic. We have lots of comments on our YouTube channel and of course our Zoom channel. And amongst other questions and comments, one person actually just said that you are spot on. You were spot on about the mental effects, and because it's actually neglected by many people, including governments of the world today. And that part is really, really, really powerful, what you said about the mental effects. So thank you, Dr. Dolly. We have a couple of questions. I'll just take them quickly. But I must say, it's really informative what you have dished out today on the show. And we really appreciate Salad Master for sponsoring this amazing program. Thank you, Salad Master. Okay, now the question is, can a person who was infected and treated and discharged be reinfected again, and why? Why is this possible? Why can this happen?
Yes. Thank you for the question. Yes. Yes, it's a very good question. And it's a very observant question. Yes, you can come down with coronavirus, be admitted, treated, tested again, and you test negative, only to be discharged and you contact it again. Now, it has happened because it has happened in the cases of chickenpox. That's when we have something like that. We call it reactivation. Chickenpox goes, when you treat it, it doesn't really vanish for your system. What it does is it goes and hides somewhere in the nervous system, only to come back again. Some malaria parasites also do that. We call it in malaria recrudescence. You treat it in the bloodstream, the drugs are flowing in the bloodstream, and the parasites go back to the liver and hide. So when the drug used to treat it has been cleared out of the bloodstream, they come out again to reinfect. But for the case of COVID-19, we don't know the mechanism in which its reinfection occurs. But what I can categorically say on this show is that yes, you can get reinfected after being treated of COVID-19, but the mechanism of action is still not very clear at this point. So when it is clear, we will also get it to them so that people will know and know why it happened. So the why we haven't been able to be answered up to now, but can you be reinfected after you get the first one? Yes, you can be reinfected.
Wow. So even when you're safe to you've gone through the process and you're now negative?
Yes.
You can be positive again.
You can be positive.
So you still have to protect yourself, the masks.
Yes, you have to
keep your immune system strong.
Yes.
Eat the right food to keep your immune system strong.
That's it. But for me, I also think that if you come down with it the first time, because your immune system have come in contact with it, they have a memory of it. So if you come back down with it again, you might not really come down as badly as the first one. Yes.
Okay, great, fantastic. Two more questions, Dr. Dolly, before I let you guys go tonight. Lots of people today are actually afraid of stigmatization. So what's the most effective way to actually curb stigmatization? What would you say?
Wow. The first thing I said when I talked about diagnosis is when you feel you are presenting with symptoms of COVID-19, call a friend you trust or a family member and let them in on what is happening. Then you call your doctor. I don't think that any doctor will spread, oh, this patient has COVID-19. No, it goes against the ethics of medicine. No doctor would do that. So first of all, confide in one trusted family or friend and then get to your doctor. They will take you to the treatment center and diagnose you. I don't think it will be spread. And then to the public, I am saying that this is a pandemic. Nobody caused it. It is nobody's fault. If you come down with it, it doesn't mean, oh, look at this person. Your immune system is. You don't even know the state of your your immune state. So there's no reason to stigmatize anybody. Anybody can come down with any kind of sickness at any time. So what we need at this time is to be patient with that person, to show the person love at that point, because from some of the patients that I've seen who have suffered from COVID-19, they said that the body pains are out of this world. The headache is on another level. So you don't need to be mentally stressing the person further. So we need to show love, we need to help, we need to be show that we care, we need to be understanding. There's no reason to stigmatize anybody. And that, if you notice, is the topic of today's show, understanding COVID-19. If you really do understand COVID-19, I don't think there's any logical reason for you to stigmatize anybody for having suffered from it.
Sure. I totally agree. Totally agree.
Yes.
But
Okay.
I think one of the things is it's a natural thing.
Yeah.
You know, people are naturally like that.
Yeah.
You know, and COVID-19, no matter how hard you protect yourself, is invisible.
That's it.
It's invisible. So if you get it, it's not if you're taking precautions to protect yourself, then we can't now stigmatize it. Kind of like say, oh, you've got COVID-19.
No. Yeah. No.
Okay, thank you, Dr. Dolly. That was very precise. Now, it's very comforting when you said yesterday that around 98% of people in Nigeria infected are still alive. That's very comforting. Yeah. And that means COVID-19 is not a death sentence. That's what you meant by that, right? Now, someone's asking Mr. Tony and yourself, they said you spoke about eating fruits and vegetables and you actually showed the machine. How can they get the machine for the vegetables, the one sitting by your side?
Well, that might be a question for me, actually.
Exactly.
Obviously, Salad Master sponsored the show. So what we're doing is we're actually going to be doing a raffle on this, where somebody's going to get this machine for free. Wow. Somebody on Dr. Dolly's show is going to get this machine for free. And Dr. Dolly is going to pick the winner out. Now, what you need to do is you need to like, you need to subscribe, and you need to leave your comments, and also leave your contact details, so that we can actually show you how useful this machine is first. So the way we're going to show you is you're going to get a live presentation. Now, because we're in COVID-19, we have two types of presentations. We have one which is virtual, which on the virtual ones, there's some that Dr. Dolly actually does, which are virtually.
That's right.
And there are some which are face-to-face. Now with the face-to-face, we come fully protected and we wear our masks and everything. And what we do is not only do we show you this machine, we also show you these foods and show you how to preserve the nutritional value. And by preserving the nutritional value, obviously it helps fight many lifestyle diseases, right?
That's right.
And also builds your immune system. So the answer to your question, Marvel, the short answer is like, subscribe, and leave a comment, and try and private message us with your contact details. And then Dr. Dolly will now see how we're going to do this raffle. But watch out, somebody on this show or somebody on the shows that we've done will get this for free. But if you're saying, well, what if I'm not the lucky person or the blessed person? How do I get the machine? Then guess what? I've just explained it. Leave it, get your contact details, and then we'll give you a call and show you a health and nutrition presentation, virtually or physically, and we'll show you how to get this machine for free. So everybody can get this machine for free.
Yes.
You want to say anything?
Wow, that's really mind-blowing, because this machine for me is a wonder one. And for you to get it for free, man, that is everything. With it, you can have your salad, have your fruit salad, vegetable salad, everything, and then your immune system is up and running. And that's what the show is all about. Be healthy. Take care of your $1 billion body.
Okay, thank you guys. Thank you very much. There are no further questions. Everyone has enjoyed the show tonight. So from me,
Okay,
I'll say.
I have one more question. One more question.
Right.
I have one more question. Yeah. And the question is, Dr. Dolly, is there a cure for COVID-19?
Well, at the moment, there's a few trial drugs that are being tried to see if we can cure COVID-19. But at the moment, there's none. But there's one or two from the US that they are passing through clinical trials to see how it works on human beings, because it has really worked on animals. Now we're doing clinical trials to see if it works on human beings, and if it does, then we're home and dry. Also, there's vaccine going on for COVID-19. Every one of them is still in the works, but for now, there's none. So the only treatment you need to do now is to protect yourself personally.
Okay, so the other question is, now you said that, there was some rumors and some worries that they were going to try drugs in Africa.
Okay.
Yeah, to test people to see whether it works.
Yes.
What do you say? Well, I mean, is that a rumor or is that true that they're testing drugs that just testing them in Africa?
Wow. Well, there's one that was not a rumor. It was real. It was said in a conference by a French doctor that it would be nice to test out the vaccine on Africans. So, fortunately for us, there were also some Africans on board. So they objected to it by citing that as of today, Africa has the least number of infected people. So it doesn't make sense to bring it to Africa. It makes sense to bring it to places who have been and are still are epicenters for COVID-19. That would be a very good place to test it out.
Okay. And the final question that I have, if there's no cure, yeah, and there's no vaccine, okay, and people get COVID-19,
Yes.
and roughly most of them are recovering,
Yes.
and becoming negative,
Yeah.
then what is it that's happening? If there's not the cure, there's no cure.
Yes.
Yeah. There's
no vaccine. Yes.
Yeah. People are getting coronavirus. So what is it that's bringing them back and making them negative?
Yes. That's a very, 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 very important and key question. An inquiring mind would have thought about this before now. This question raises a lot of eyebrows. That I am a patient. I tested positive for COVID-19. I walk into the isolation center and I am retested and I still test positive. I am being held there or being kept there for 2 weeks and given drugs that are known to me. And after the 2 week stay, I am tested again and I test negative and I am discharged. So then, how can scientists and medical personnel now say that there's no cure? Because whatever it is that was given or that was done inside the isolation center that turned the person from positive to negative should have been the cure. Well, that is why we say that there is a lot more questions COVID-19 that there are answers. And we are still awaiting the experts and those people who have it in their country more than we to give us the answers to this, because I myself, I am very curious to know.
Because there's something going on, I think I read somewhere, Madagascar.
Yes.
They had some natural
Herbal
remedy.
Yes.
Yeah. And I heard that, I think it was President Trump.
Yes.
Was talking about.
Yes.
So, I mean, have you heard anything about it?
I have.
Okay.
I've heard it.
What?
My take on that?
Sure thing.
Well, in medical school, we were taught in medical school that orthodox medicine, that is the medicine I read in medical school for years, it's not the only way. That we shouldn't have a closed mind to medicine, rather we should have an open mind. Solution can come from anywhere. So we are not saying that the herbal drug doesn't work. I am a medical doctor. and I am all for it. And from what we have seen, Madagascan people have said that they have tested positive and they take it, and it cures them. So it fell on our government to say, bring in on the Nigerian Center for Disease Control DG to say, bring in these medications, let's pass it through our lab and determine what you used to do it and how it was prepared. And if you think it meets the NAFDAC standards, then we should not hesitate to try it on our people.
Are they drugs or are they just natural remedies?
They are natural remedies, they're herbal.
Okay, so do they really need to be tested in the lab?
Yes, they need to be.
To be certified.
Yes,
by
to be certified
profession.
by us,
Okay.
before we give it to our people. Because if you say, oh, those are herbs, curb it. Every drug you have under the face of the earth come from herbs, roots and all whatnot. So nothing came from the factory itself. The factory got those drugs from somewhere, because it's from the roots of the trees, herbs and all of that, and then processed it, took away the impurities, and then made it pure and concentrated it in form of tablets, and then you give it to people. So that is what the fear should be. If the herbal drugs from Madagascar are free from impurities, if they are free from impurities and we view it and see that this is okay, there's no reason why anybody shouldn't.
Because in the UK, one of the things that I found out in the UK is that if you're positive,
Yeah.
then some people stay at home.
Okay.
And they stay at home and they go through the process, and if it gets to a certain point, they go to the hospital.
Yes.
I think, if I remember rightly, the Prime Minister, Boris Johnson.
Yes, he came down with it.
He was positive.
That's right.
But he stayed at home for a while.
Yes.
He stayed at home for a while before it got a little bit more serious.
Yes.
And then he went to the hospital.
That's right.
So is it that there is something that do they have some hope that somebody that is positive can still recover naturally?
Yes.
Yeah, before they go to the hospital.
Yes.
And just one last thing, because Prince Charles, if I remember rightly,
yes,
was positive at the same time as Boris Johnson,
Johnson.
similar time.
That's right.
But Prince Charles is well known for health, well known for natural foods, well known for organic food, well known for protecting the earth. But somehow he stayed at home when he was positive.
Yes.
And recovered.
Wow.
So
yes. So my take on that is when the last episode we said that in the symptomology for COVID-19, I said that it was divided into mild, moderate, and severe. Most people fall into the mild, moderate category, in which if your immune system is up and running, it can knock it off and it will just, manifest to you as just mild. So you come down with flu. That's what, when I said that if you have the mild infection, it just affects your upper respiratory tract, meaning your nose, your mouth, and then upper pharynx, that's upper throat. That's all. That means your immune system has COVID, because like I said, immune system has barriers at each stage. So for it now to go all the way to your lungs means that there's no barrier. Nothing is fighting it inside your body. So it has a free access to go anywhere it wants. So it helps to feed healthy, feed organically, so that your immune system fights with you.
So really, if you put it this way, when COVID knocks on your door, make sure that you are healthy. Yeah, make
so
sure
that your immune system comes to answer the door.
Make sure the immune system opens the door.
That is it.
But if your COVID knocks on the door and you have maybe, I don't know, diabetes, or you have,
oh my God,
you have respiratory, you have asthma and so on.
That's right.
Then it might not be the immune system that opens the door. It might be one of the lifestyle diseases that opens the door. And the two of them collaborate.
Long lost friends. And they will deal with the system.
So I think it's very important for us. That's one of the reasons why why we sponsor the show, Salad Master.
That's right.
And thank you, Dr. Dolly, for coming on the show.
Okay.
Thank you, Marvel, for being part of the show and making sure we're doing the right things and getting the questions. Thank you to the public for listening to us. It's been longer than usual because this subject requires even more than one program.
That's
So
right.
there may be some questions you have unanswered. If you have questions on answers, please let us know, because if we can, we'll put. Am I right, Dr. Dolly? Can we have
That's
another show if the questions are unanswered?
If it's required, why not?
You heard it from Dr. Dolly. If it's required, so if you put those comments in, you let us know. If it's required, we're going to do another show on COVID-19. But meanwhile, I think there are other shows, because, like Dr. Dolly mentioned, the fact that we need to be safe, we need to be healthy, we need to be protected. Now, obviously, things like the lifestyle diseases like diabetes, high blood pressure, cholesterol, stroke, cancer, all these things are things that we need to cover.
Yes.
Because really, they are part of protecting ourselves from COVID-19.
That's right.
So that means that the next few shows will be on the, am I right?
Yes. We'll be taking on lifestyle diseases that makes your immune system come down and predispose you to COVID-19. So we should be looking at how you are going to protect yourself, how you're going to manage it, how you're going to even possibly revert it completely so that you're free and you get your system healthy and running.
Fantastic. Did you hear that? We're gonna take care of you. Don't worry, we are taking care of you. Lockdown, no lockdown, COVID-19, no COVID-19, we are gonna take care of you. So that, guess what? Your immune system is strong. And in Salad Master, we'll take care of your food, because your food requires a lot of nutrition to protect the body. So in Salad Master, this program is sponsored by Salad Master, we'll give you free virtual shows. So everybody on this show, or everybody that watches this video, we'll give you a free health virtual show, so you can see how we can protect your food even more. And therefore, as I say, if you protect your food will protect you.
That's right.
So again, thank you very much, Dr. Dolly.
Thank you, Mr. Tony.
And thank you very much, Salad Master, and thank you very much, Marvel, and thank you very much, the public, and thank you very much, the world. So on this note, we'll say thank you and bye-bye.
Bye.
Bye. Bye, Marvel. Bye.
Bye, everyone. Thank you for joining. Great night.
Thank you. Good night. Good night.